the outset, let me welcome you all to this special webinar. And I wish you all Ramadan Mubarak. Indeed, the month of Ramadan emphasizes philanthropy. Caring and sharing is almost second nature, not just for individuals, but also institutions. Indeed, companies in India have corporate social responsibility mandated by the law. The Ministry of Corporate Affairs monitors and ensures that every profitable company spends at least 3% of its profits on CSR activities. These are defined and tabulated. And recently, COVID-19 related philanthropic initiatives have been included in the CSR mandate. In the UAE, companies or institutions or individuals, but it's a good initiative. It's best practice that companies and not-for-profit institutions like IBPC should evolve a code and a policy within Dubai when during times of crisis, we can be prepared and robust response can be arranged. As the demands are no less, especially during crises and calamities, both from a funding perspective and in terms of volunteering. Last few years, we supported the Al Jalila Foundation in 2018, the Al Noor Center for Special Needs in 2019. And this year, we allocated a budget of 225,000 dirhams to support the splendid efforts that the Consul General Vipul ji, who is joining us today, in catering to quarantine and isolation of blue-collar workers in Al Warsan. We have a distinguished panel today, and the four of them need no introduction to this audience. They have consistently demonstrated high-caliber leadership on the one hand, and generosity in terms of wholehearted philanthropy. Let me start with His Excellency, the Consul General Vipul ji. Vipul ji, you have demonstrated strong leadership and you were able to effectively coordinate with the governmental authorities in responding, especially to cater to the vulnerable sections of the Indian community in Dubai, especially the blue-collar workers. I'd like, if you can please share your experiences and your thoughts in this regard, as how this tremendous initiative in not just catering to blue-collar workers or the Indian community here, rallying them together, but also supporting through specific initiatives, the relationship between the UAE and India, between Dubai and India. So I'd like to hear your thoughts in this regard, Vipulji.
Thank you, Suresh ji, for very kind words that you have said. I would like to congratulate IBPC in continuing to do their activities through webinar in this pandemic situation and choosing a very important topic of CSR because this is what is definitely most needed in the wake of this pandemic. I feel that when we talk about CSR, especially for large corporates, I think there are two angles to it, two dimensions to it in the wake of COVID pandemic. One is corporate taking care of its own employees, people who may not be required perhaps, but the corporates have to devise ways and means so that we do not have large-scale laying off and people are able to support their families by working in the corporates where they are working. Of course, the business sense has to be kept in it, but I think it's very important to take a more humanitarian, more considerate view, especially in this situation wherein there will be disbalances across the value chain in almost every corporate, starting from, for example, civil aviation or tourism sector or hospitality sector and going on to almost every sector of the economy. And therefore, I think the corporates have a special responsibility towards their employees and families to see how best they can support them in this situation. The second dimension, of course, is corporates taking a view of communities which are around them, and then nationally and globally. And in that also, I think CSR is very, very important. And I'm talking not only from a general perspective, but especially from the perspective of the COVID pandemic. I think globally, we are all seeing that people are not able to earn their livelihoods, and the support for them is very much needed. That is even more so in country like ours, in India, and also for Indians who are based here in UAE. It is very, very important that we support our workers, our people who are not so fortunate. And I think in that, the corporate social responsibility definitely comes in. And I think with corporate social responsibility, a lot of pain that is being inflicted on people right now can really be alleviated, and that is really important, and it's very much required along with the government efforts, which in any case will continue. Here in Dubai, of course, as you said, we try to work on isolation and quarantining facilities, and with the help of Dr. Moopen, we were able to make some headway. And then we adopted one building in the Al Warsan area, wherein it's an effort which supplements. I think it's very important for all of us to be aware that the magnitude of the problem that is being faced is very big, and it's also very complex. It's very complex because for our workers, many of them stay in shared accommodations, and then in shared accommodations for a contagion like this, it becomes very, very difficult, almost impossible to separate everyone who is either who has contracted a disease or who might contract the disease because someone else in a particular room has it. I think in that respect, DHA, Dubai municipality, and all other government agencies in UAE have tried to do their best so that the situation can be contained and people can be isolated. But the magnitude of the task, given the way this disease is very, very difficult. So we thought we will supplement their effort, and we volunteered that we can get some Indian doctors and nurses together so that they can man one building in Warsan, and that building is currently running. We have about 493 patients in that building. So it's a small little contribution, let's say, of the Indian community towards the overall effort of UAE in helping people in this pandemic. We have about 10 to 12 doctors and 12 or 13 nurses who are working at any given point in time in Al Warsan, and I'm very happy and very thankful to IBPC for coming forward to support that initiative, because it does take a lot of finance to run these kind of facilities, and also that motivation for people to run it. So that's only one part of our effort. The other part that we have been doing is supporting some of the people who have got stranded here in Dubai and in UAE, and who are in need of medicines. And we are trying so that we can arrange medicines locally for some of the people. So with that way, we have supported almost 150 people so far, and maybe the number will increase further. Apart from that, I must say that a lot of community organizations, Indian community organizations, have done their bit, especially KMCC, which has been doing quite a lot in terms of volunteering. And a lot of other organizations have also come together to provide food and accommodation for workers who have been left stranded, who have lost their jobs, or who came looking for jobs. I mean, something that they should not have done, but a lot of people keep doing it. And in that, the consulate has been providing food, but our overall effort has been that the community itself should come together and support people whom they know with food by banking upon the philanthropy of different individuals and different organizations here. Kandhari ji is here. Through Kandhari ji, we have been supplying food to a lot many people almost every day. But there are a number of individuals, and I must say that in the community, there is a great feeling of giving, and that feeling during Ramadan is also even more there. And a lot of organizations are doing very good work in terms of supporting people. Going forward, I think this will be even more needed. As you all would have followed the press, we have almost 175,000 people now registered in our database who want to go back to India. About 40% of them are people who have lost their jobs. These are workers. And then there are a variety of other people who have medical problems, pregnant women, people who got stranded here, who came on tourist or visit visa because they must be meeting their family or for other reasons. When we go ahead, and they have been through a lot of pain and patience. I think these were extraordinary circumstances, and people have by and large been very, very patient. I must appreciate that also. But as we go forward, I'm sure there will be a lot of people who will need our support, both in terms of their accommodation, in terms of food, but also in terms of finances for returning back or for giving on their finances, etc., fines, etc. I think the corporate social responsibility and the general social responsibility of each individual towards the society in which the person is living, I think we will need that more and more, especially in the next 3 to 4 months, and hopefully this pandemic by then will subside at least a bit, so that we are able to start functioning and living more normally. But especially in these 2-3 months, I would implore all the membership of IBPC and IBPC itself as well, that we should keep a lookout for everything and keep supporting the society as much as we can. I've not said anything about Parasji, but with Parasji again, we keep working on different social issues, and he also always supports the consulate in this work. But overall, I think we have to do this work together. We have to do this work together as the Indian community, but also we have to do this work together with the UAE. And therein, and I'll finish with this, just mentioning 2 or 3 points about how India and UAE are also working together in this. The first, of course, was the requirement of hydroxychloroquine from India, and that was whatever we could do. India gave a lot of hydroxychloroquine tablets to UAE. I think another tranche of that should be coming in the coming days or weeks if it's needed. UAE itself, as you would have seen, has sent a lot of supply yesterday to India, and India again has accepted the request from UAE to send some medical personnel who were stuck in India to UAE. And overall, our leaderships have been in contact all this time, and both our countries are working together to see how we can fight this pandemic together. You would have seen some of the media reports basically saying that India should take back the people. I think there is the realization both in India, among the people here, and the leadership in UAE, that India has tackled this pandemic in one particular way, which is the way of lockdown. And it was very difficult for India to immediately start taking people back. We must realize that Indians live in UAE almost as if they are living in India. They don't treat UAE as a different country. And then suddenly, for a lot of people to go back to India in a lockdown condition was very difficult for government of India. Now there are discussions which are going on, and hopefully Soon we will have flights resuming so that people can start going back. But in all this time, I think our leaderships have been together, and no matter some of the press reports that you might have seen, I think we are dealing with this pandemic together, and both our countries and our communities, our peoples will be fighting this together, have been working together on all issues. So India and UAE, as we go forward after this pandemic and during this pandemic, will continue to work together, and that is a duty for all of us as well. So thank you very much, and thanks IBPC for arranging this. Thank you.
Thank you, Vipulji. I think that was hugely heartening, and I think I and IBPC, all members and the panel applauds you for your leadership and for taking the initiative to bring the community together during challenging times. I will come back for a second round of questions, at which time I'll need your views and thoughts. I'll now move on to Dr. Azad Moopen. Dr. Moopen, you have had a history of philanthropy, and your company, Aster, is in the forefront. Aster volunteers are visible everywhere, and it's good to see a leading corporation, both in India and here, such as yourselves, to take that initiative under your leadership. Tell us your vision and tell us your thoughts and your motivations in this regard.
Yeah, thank you very much. Thanks a lot, Suresh, for giving the opportunity, and thank you for the nice words which you mentioned about Aster volunteers as well as myself. So this is a most appropriate subject which could be discussed at this point of time. And all the people, the panelists sitting here, the Honorable Consul General as well as other panelists are most appropriate to be there, because they have shown that what could be done apart from their official as well as their business activities, and including you, have been very, very supportive of the cause. And I again reiterate the great support provided by IBPC during the times of need, when the community wanted that, and giving the required financial support for the project to go on. Along with the consulate, we were also involved in that project, and it is still going on. Now, coming back to your question, the most important reason why we are there is that we thought that it is our responsibility to take this up as a human being, as a resident of this country, as well as a resident of course, an Indian national who is present here as well as in India. So we are all lucky people. All those who are sitting here are lucky by our birth as well as by our present position. And when you look at people who are not like that and who are actually having a lot of requirements by way of their necessities, God has been so kind to us. If you look at in that way, where God has bestowed on you a lot of benefits by way of your health, your wealth, your position, your fame, your everything God has given you. And isn't it the responsibility of all of us to give back a part of that to the people when it is required? It's a very simple philosophy which should help us to give back a lot. Fortunately, many people feel like that. Unfortunately, even a lot more people don't feel like that. Whenever there is a requirement, people don't come forward so much. And that is something which we should look at and see that more and more people participate, for which there has to be a real motivation for people to do that. And this is one of the best times when people can be made to understand the importance of participation in this. So at Aster, this is not a second nature. I should say that it's a first nature for large number of our employees, because every day as part of our values, we talk about the requirement to give back. And of our total number of 20,000 employees, 17,000 of them are Aster volunteers. They have volunteered to be there, who can volunteer themselves to do something as well as give their resources. So one is the material things. Another one is their giving their efforts by way of their expertise. Even there are people, the families of these people who have joined, they don't have resources to give, like what we usually say, the material, or what is their professional skills, but they just are there to provide that comfort when we do a program for people with special needs. They are just there to encourage the children who are there with special needs, or to give them support. So any one of us can provide support to another human being if we have that mindset. And we are in a country which believes a lot in giving back and giving to the others who are in need. We every year see this, not only during Ramadan, but even other times we see a lot of aid going from this country to other countries. Now this country itself is in requirement of something. And also, of course, we know that our country back home, India, also requires a lot of support. So for us, this is the ideal situation. So we have about 27,000 people now all together as Aster volunteers, and the leadership team along with the volunteers decided that whatever is possible we must be doing. So we have been doing this for a long period, and now last 5 years at least we have been very actively under this banner. Earlier it would have been individual, but under this banner we have been doing a lot of things. When there was huge issue in Syria, we went and established a camp in Jordan where we kept our doctors, and we were supporting the community there. During the recent issue in Nepal with the landslide and a lot of houses being lost, we provided housing for nearly 300 people. We provided housing there. Now we also provided in Somalia, when there was huge famine recently, we sent 2 container loads of food packets to Somalia. And every day we do things. Now back home in India, when there was this huge floods which happened in Kerala in 2 tranches, one the year before and last year with the landslides and all, there was requirement for building large number of homes as well as medical care, and we were actively involved. In fact, we are in the process of building 250 homes for the people who lost homes there at a cost of about 15 crores of rupees, and of which 100 homes were already handed over in 2 months back, just before this COVID happened. Apart from that, we have large number of vehicles which are going around, mobile medical vans. One is actually there even in Dubai, where we go to the labor camps and provide support. So Aster has been in that forefront, and for us it was such a easy to get integrated to whatever was required. And with the significant amount of the social organizations which are providing this support, we are actively involved and we are in the forefront of the care, because we are a medical organization also. So just to give a small peep into that, which will give you an idea of how much we are involved in that. According to official statistics, we have about 12,000 to 13,000 people who are detected as positive COVID cases, either in quarantine or in the hospitals. These are the people who are there, and there may be some people who are still in their accommodations. And we are involved in the care of about 3,000 of them through the accommodations, like what we are doing along with the consulate, and also we are doing it in other places like Jebel Ali. We have large number of hotels in which with DHA, we are taking care of large number of the COVID positive patients. And of course, in our hospitals, not only the mild and moderate cases, but severe cases also. So about one-fourth of the total number of cases, we are involved in that management. And this is something which has been very exceedingly well organized by the local authorities, the Dubai Health Authority, the police, and the municipality, the Dubai Tourism Department, who provided the hotels and all. So there has been a huge involvement, and if you look at the expenses for that, it is humongous, because we run at almost 100% capacity in our hospitals with only 30% of revenue, because the revenue has gone down to 30%, but we run at 100%. All our people are involved in taking care of these people. So there is a requirement for us to give back, because in good days, we have been beneficiaries of whatever Dubai could provide. And in such difficult times, we should be in the forefront of that. And back home in India also, we have done whatever is possible, again, for the states which were affected, where we have operations. We have supported the governments through financial aid, as well as we have also opened up our hospitals in India for admitting COVID patients. So we have promised 750 of our beds in our hospitals in India to be available for any governments which can send patients, and we will be taking care of that. So I don't want to prolong. I have told a lot of things, and it is sort of a bragging, but I thought that in areas of CSR or helping others, an amount of bragging is allowed, because let this actually incite the people who are there, like what I told first, to come in and help others. There is no need for secrecy in this area, because this will at least prompt one person to do that. And we know that this has happened with great people like with Warren Buffett or many others who have gone into this, promising large part of their wealth to take care of people, and they have done it publicly. So if all of us start doing that, at least to a small extent, we will be in very good place regarding this. And I really appreciate the Consul General, Vipul, for leading it from the front. You may not be seeing it, but every other day, or at least twice a week, we have discussions with him regarding how this can be structured and how it can be made more effective, and it can be made accessible to more people. And thank you very much. Thank you.
Thank you. Thank you, Dr. Azad. You personify philanthropy, and we're happy to hear. In fact, I think you have given only glimpses of the contribution that you have made, and I'm aware over the years you've been a pillar of support. I have a few questions, but we'll come back for a second round. Let me move on to Parasji. Mr. Paras Shahdadpuri is a doyen of the community. He has been one of the founding members of IBPC over the years, and philanthropy comes naturally to him. He has been associated with support during every crisis that we have had, whether it is the first Kuwait invasion to the days of earthquake in India, and more recently in every single matter, he has been generous to a fault. I'm aware that more recently he's also working with some of the key UAE ministries in terms of climate change, in terms of environment and the like. So I'd like to hear from you, Parasji, your thoughts, views, the motivation that is needed, how we can broad base this initiative.
Thank you, Suresh. First of all, let me wish everybody Ramadan Kareem. Good evening, namaskar, assalamu alaikum. Suresh, this is a great initiative which you have taken during the month of Ramadan, but not only this particularly the COVID-19 situation. This is unprecedented, and this is a great initiative by you to bring to the fore of everybody how we all need to come forward for the community welfare. In fact, I have been thinking that what is CSR actually. Luckily, you have not written corporate social responsibility, but the community social responsibility.
Yes.
But as the things evolve, I would like to perhaps give a new acronym to this as CSI, which is community social investment. Honestly, today it is the responsibility of each and every individual, whosoever has certain means, to come forward and not discharge this responsibility, but invest into the society. Once we invest into society like we do in the business, in business we do it very fast. We do invest in employees, we invest in some other plant machinery, capex, etc., etc. Same way, if we invest in the society, we get back, maybe a little slow, but we do get back our rewards business-wise and your satisfaction, because after all, your personal satisfaction is the greatest thing which can't be measured with money. Quickly, to respond to the call of Honorable Consul General Vipul ji and IBPC, I was just thinking, and if I can make a very token small contribution myself by announcing that I would like to donate or give or invest 100,000 dirhams for this cause, whether it is in kind, because we are in the face masks, we are in hand sanitizers, or the cash, whichever is worked out will work the modalities with the IBPC and the Consul General. So this will be a very small token, which I hope they will be able to accept it.
Thank you.
You see, the concept of giving is very age old. I mean, this is in our DNA, by way of giving, you know, what we call as dan, or diksha, or dakshana, or zakat, or even sadakat in India. So this has been on, and I'm very happy that the Indian community always comes to the fore in any time of difficulty. Whether, as you said, there are so many instances when I remember there was a call by His Highness Sheikh Mohammed bin Rashid Al Maktoum for Dubai Care. So I remember that I seemed like now instantly had got the urge to contribute my small mite. So all of us have come forward, whether it is, you know, any difficult events or generally. I'm happy that you could attend one of my recent dinners, which was in February. We not only supported the handicapped children school, which is the School of Determined, but also we committed to plant about 500,000 to 1 million trees in collaboration with the Ministry of Environment and Climate Change. So this is, I feel that this is our bounden duty. This is our natural duty that we must also contribute to the society, particularly where we live, which is our Karam Bhumi, and of course our place of our birth, our place of our nationality. So I am very delighted that I find large number of people who always have come forward, and we have never found any dearth. I'm sure our great friend Surender Kandhari will be speaking that nobody goes hungry from the door of the Gurdwara. Nobody should go hungry ever. And this is our absolute duty to make sure that everybody is looked after, at least food-wise. There are so many other things, other requirements also for a human being, which we normally do during the month of Ramadan by distributing food packages, etc. So I'm sure the Dubai government is coming up with various different initiatives. There's a great bonhomie between India and UAE. We saw a large aeroplane or a large number of medicine packages going to India. Consul General recently said, and we read it in the papers, that India is volunteering about 88 medical staff to support the endeavors and the efforts of UAE. So there is a tremendous bonhomie and feeling of doing something between not only the two countries, but the communities which are residing here. And I'm sure this is duly appreciated in UAE. Also, UAE has been taking from time to time various different initiatives, not only Dubai Care, but then Year of Giving, which was in 2017, This was a very great initiative. And they want to make this as a part of their entire strategy. It's not a one-time that, okay, they said that we want to have a year of giving in 2017 and then forget everything thereafter. No, they have made it as a part of their national strategy. In fact, the UAE is one of the top countries in World Giving Index, as they call it as WGI. And we are proud to be part of this society here, part of this country where we reside. So I feel that all of us should contribute whichever way. By the way, it's not only the monetary contribution. People can volunteer various services, which I'm sure the Consul General had kindly referred. Now that there are so many people who are volunteering, they're not charging any money. They're giving very precious time. They're taking perhaps so-called even risk of being on the front line of this COVID-19 and taking the sort of danger of the infection what it gives. But I pray everybody that people remain safe, people remain healthy, and we are here as a part of the society, as an integral part of the UAE society, as a part of the integral part of the Indian society, and our governmental efforts and efforts of great organizations like IBPC and others to always come forward. In fact, last week we have raised, among a few friends of ours, have raised another small amount and we contributed there for this COVID-19 efforts. So we are here together in this great effort in this tough time. The times are really, really tough. I got the results of April and I'm not very happy to say that we did a great job company results wise, but I think this part of life, nothing is going to stay permanent. This will be a phase also which will pass by behind us, and we will come back triumphant, leaving behind the corona. Thank you. I think somebody wants to say something.
Thank you very much, Parasji. I compliment and appreciate your gesture and your spontaneous commitment to contribute 100,000 dirhams for the COVID-19 efforts, which I'm sure the Consul General Vipul will also appreciate.
Welcome.
We can always count on you. You're Mr. Reliable, not just for Nikai, but also for the community here in Dubai. And thank you very much. I'll move on to Mr. Surender Kandhari. Surender ji, the Gurdwara is, a monumental initiative or example of what the Indian community can do when under your leadership it was all put together and built. It's something that we're all very proud of. Every visitor to Dubai from India and every resident from India that are here in Dubai always find it a matter of great pride. Tell us your experiences, in bringing the community together, the contribution that the Gurdwara and yourself personally have been making. You have been leading the way, as it were. Share with us your views as well.
Thank you, Suresh. Thank you very much. Good evening, everybody.
Good evening.
First of all, I want to wish all our Muslim brothers and sisters Ramadan Kareem. And I feel I have a dual role to play here. One as a head of a corporate group, and second thing as head of the Gurdwara. We in the Sikh community, it's in our DNA to serve free food to every hungry person in the world. And wherever you see in the world today, due to this pandemic, every Gurdwara in the world is serving free food to all the people who are required. And so also in Dubai, we have taken the initiative. We are supporting the Indian consulate. We are supporting the KMCC. We are supporting the Dubai taxi driver people. We are supporting several other NGOs and supplying them food on a daily basis. Some people require cooked food. Some people require raw food. We are trying to reach to everybody because we do not want any hungry stomach among our community in Dubai. We are very happy that we are able to have this opportunity to serve. and to support the community. What I personally believe is through the IBPC, this I'm addressing to Suresh, that you should pass a sort of a informal law that every corporate should have like a provident fund or like they should have a CSR fund in their account. Say about 2% or something of the net profits should be kept aside for this type of service, because I think it's very important. Unless a directive is given to all the companies, as Mr. Azad Moopen said earlier, not everybody wants to serve, not everybody wants to give. I think if there's a directive from the IBPC that every member should keep at least 2% of the net profits in the CSR fund, and this can be used when is required in this difficult situation. I personally am going to be the first one to offer you this, and we would love to contribute to this cause, because we are all children of one God, and we are all together in this. There's no nationality, no caste, no creed, no religion. We're all human beings, and we should support each other. And I think if IBPC takes the initiative and requesting at least the members companies to participate, this will be a good initiative to start with. And from my side, I think the Indian Consul is doing a fantastic job looking after the people. Every Indian who's able to support is supporting. And I'm grateful to the IBPC for taking the initiative to support the community. And now that the repatriation starts, I also already offered to Our Excellency Mr. Vipul that when the money is required for repatriation of for air tickets, we'll be part of it, supporting them for sure. Sky is the limit, but we will support whatever we can. And the other thing I would say is, at this time, we should forget all his egos, forget all his caste and creed, and be one, support humanity, support everybody. And I wish everybody Ramadan Kareem. God bless all. Thank you very much. Thank you, Suresh.
Thank you. Thank you, Surender. I think, through your actions and efforts, you support tremendously. And I think you've also been giving us advice from time to time in IBPC, and I appreciate that. I'll move back to Vipulji briefly for my second question. This is a broader question in the sense that COVID-19 is a crisis, but we also have some chronic maladies in the affecting the community here. To illustrate, I'll give two illustrations. One is Indian blue-collar workers live in accommodation which are 5 or often 7 or 10 to a room. And so not just social distancing, but even hygiene and proper operating accommodation is not available to them. Part of this is acute in sectors like the construction sector, etc. So one of the initiatives that IBPC would like to consider in terms of policy advocacy is to work with the UAE authorities, and my initial approaches to them, they seem quite positive, to make sure that both legally, procedurally, but also in terms of the community organizations taking an initiative, we need to address this, especially in the construction sector and areas of this, because this is not going to be the last of the pandemic. Hopefully this will be the last, but we have to be prepared for challenges ahead. And therefore our responses will have to be structural, will have to be strategic, and something that is sustainable over a period of time. So Surenderji, your point about raising corporate contributions on a sustained basis is a good one, and I'll come back to it later. There are also a few questions from members on that front. But the second point is that there are a number of special needs students, especially from the Indian community, that are currently being coached by the likes of Al-Noor or Rashid Pediatric Center or SNF. And Rashid Pediatric Center, Parasji is associated with it. SNF, I think Surenderji is a board member. So all of them require support. Once, when we made the announcement of supporting Al Jalila Foundation, many of them came and approached us and asked us for contributions, etc. Because inherently, the the fees that they charge are not sufficient for the costs they incur. So there is a longer term gap that community organizations need to address and work with them and work with the authorities concerned, because ultimately these matters need to be brought to the attention of the authorities so that it can be a more sustainable long-term solution to some of these challenges. I would like to hear your views and suggestions and thoughts and advice for IBPC.
Thank you, Sureshji. I think both of those points are important. One, I think, is very long term when you talk about the workers and improving their accommodation or working conditions. The other one is something which is ongoing, which is about the special needs kids or differently abled people, in which IBPC has contributed. The consulate had taken some lead. Parasji, for example, remains in touch with those organizations. Others also do their bit. As far as the workers are concerned, I think over the past few years or decades, I think there has been a very sustained effort in UAE to improve their working conditions and living conditions. And I think UAE has done quite a good job in that respect, especially if you look at the labor accommodations in Dubai. In some of the other Emirates, there is some difficulty, and I think more can be done. More is more desirable in terms of their living conditions. Government of India by itself also remains concerned and always engages with UAE in terms of improving their living conditions and working conditions. With that in mind, Government of India had launched this portal called e-Migrate, so that any worker, especially those who are more susceptible to these kind of things, they know their working conditions and their salary and living conditions beforehand, before they come to UAE. A lot of people come to UAE now through the e-Migrate. We get almost about 180,000 to 200,000 annually who come through the e-Migrate. But it also remains a fact that a lot of people come on visit visa, either looking for a job or on promises of a job. And they come here through dubious means, through dubious agents, I would say. These are unregistered agents in India who might have some of their people sitting here, and it becomes very difficult to either regulate it or to take action against them, even if they have committed a fraud, and even if we get to know, because it's an inter-country thing. But overall, I think if we can couple the systems of the two countries, our e-Migrate with the UAE system of labor intake, I think that will resolve many of the problems, especially of the workers who live in very cramped conditions. And hopefully, if we move up the skill zone, then we will have more skilled Indian workers who will have better salaries and should be then able to afford better accommodations and better living conditions. And overall, I think if IBPC can do some advocacy in this regard, that will be very, very useful, not only for Indian workers but for other workers as well. As far as the differently abled differently abled persons is concerned, there is a lot of work that is being done in the community itself. We have many hidden heroes, I would say. You took the name of Al Noor, Al Jalila Foundation, etc. Our own Indian association in Sharjah, it also runs a school for differently abled kids called Ibtisama, which started last year. In our consulate itself, we have an initiative wherein we get together with the differently abled kids and their families and see as to what can be done in terms of advocacy, etc. But again, the more we can do for that, the better it is. I was very happy when IBPC hosted its iftar last year. I think it was Al Noor or Al Jalila, I'm forgetting, in one of these two organizations. And I think similar kind of things, I think we definitely need both from IBPC and for the community in general. That will be very helpful for the Indian community as well as for the larger community. Yeah, thank you.
Thank you. Dr. Azad, any suggestions in terms of what the community and IBPC can do further?
Thank you, Suresh. Thank you for asking that question. So like what everybody said, even starting a discussion on this is something really great. The IBPC's role is to be a platform on which all the people, because if you look at the community in Dubai, all the people who can do something are members of IBPC, and their active participation, like what Kandhari ji said, if there is a definite way in which all of them can get involved in that, with people like Parasji and all actively involved already, and if we can get everybody into that, that will be the greatest platform which can be there. See, we have many associations of the Indians in UAE or in the GCC, but this is a business and professional council which has got the wherewithal to do something like this. It's not something where a social organization or a cultural organization. So that we must utilize that capability of the community to pool together the resources, financial resources, and second, the intellectual resources for advocacy as well as for other matters. They all have excellent connections with the people who are in powers in these countries, and we must utilize the power of the IBPC platform for taking this forward, like what you did today, and with the support of the Honorable Consul General as well as the Ambassador, I'm sure that we will be able to drive it forward and make it the voice of the community at a highest level to make it effective. So I congratulate you and also offer all whatever support is required.
Thank you.
I will say something, Suresh.
Yes, please.
You perhaps know that I am the board member of the Rashid Center for the Determined Children. So they always have been short of funds also, and as much as Al Noor and all these institutes which help the handicapped children or the children with different needs. So if there is anybody else who would also like to join me, I'll be very happy. As a board member, and perhaps I'm the only one Indian or maybe two Indians. Yes, no, Mr. PNC Menon also now become the member. So we are trying to put our might together and even help them to collect the funds from some other friends and well-wishers. Regarding your very important question, I remember when I was a diplomat in Saudi Arabia, I was confronted with this 6 people, 8 people in one room being huddled together, which was really very pathetic. I think this can be taken up with the Ministry of Labor, that not more than 4 by a certain size of the room, which is currently they are giving 6. So let the same size remain, but not more than 4 people should be accommodated. And in the contract which is signed in India, the employer must commit it that he will provide accommodation where one room will be given to 4 people. Now it's just a costing at the end of the day. So the costing is passed on to the project person who's giving the project. So it's a even playing field for all. In the case of the Indians coming from India, the agent or the employer should give in writing that this worker will be given an accommodation with 4 people in one room. I think this should be quite possible to achieve, provided we are able to strike understanding with the Ministry of Labor here and the Indian government of India.
Absolutely. I think it's a matter of dignity. And also in the past, I remember 45 years back, during Sheikh Rashid's time, he listened to the Indian community and built the likes of Karama, Satwa, and the like. These residential centers came about as a result of
Yep.
aiming for low-cost, affordable homes for the expatriate community. Yeah.
They were very dignified and still affordable.
Dignified, affordable, and decent,
In middle of the town.
Absolutely, absolutely. Surender ji, your thoughts in this regard? You have been part of
I think,
IBPC initiatives.
thanks, Suresh. Well, I personally believe that unless the owners of these construction companies are held responsible, because a lot of companies today are abandoning the workforce, letting them to literally starve on the labor camp, not giving them salary, not giving them food. I think there should be some law or some sort of a regulation that these persons should be held responsible for all the workers they bring in. This is one thing. And second thing, I'm talking of the special needs children. I would say if IBPC can take the lead and have a corpus fund, every member can contribute whatever he can, whatever he wants to. You have a separate fund created in IBPC, which can be distributed to 3 or 4 or 5 organizations which need the money. I'm sure if we have over 1,000 members today, and every member gives in something, it can come to a big fund which can be distributed to all the organizations. This is only a small way we can contribute to support these organizations. So on both the angles, I think we should give a deep thought to it and try to improve the plight of our Indians.
No, thank you. I think my thoughts exactly. In fact, while fundraising per se is highly regulated and requires a pre-license approval and organizations like IBPC or the India Club in fact does it for the purpose of its MNC, can charge a fee which can effectively be then managed with good governance, good oversight, good disclosure, transparency towards this effect. We have crossed an hour, but I'll just take a few questions from the members. There are a few questions, more than a few questions. I'll try and summarize them. The first is from Mr. Brahmanandan. He says, I salute the great efforts by our members, particularly in healthcare area. Is there a plan to pool resources by IBPC as an organization to support the consulate in supporting the Indian community amidst the pandemic situation? I think the answer is yes, and we will work on it. Dr. Hemant Chetwani says the CG should consider structuring a fundraising vehicle for the community to contribute. Vipulji, would you like to take that question? I know it's, fundraising per se is an issue.
Yes, so we're not looking at fundraising as such for any activity. What we are doing is kind of acting as a matchmaker, so that we can connect people who want to give to people who can receive it in a meaningful manner. That has been our effort. But if anyone wants to contribute, see, the issue is if you contribute, then it goes into Indian Community Welfare Fund. Indian Community Welfare Fund is like a pool. So from that pool, it's a lot of things which are there in that pool. So you can't say later on that, okay, I have given this much money, you use it for this particular purpose. Then it will be spent as Government of India's money and in accordance with Government of India's rule. Now, what happens is normally when people give some money, they want it to be utilized for specific purpose. That we cannot do because once it goes into a pot and then whatever you pull out from that pot, it's like anyone's money. So that's why we thought it is better to do matchmaking, but it doesn't stop, and many people have contributed huge amounts of money to ICWF as well, to the Indian Community Welfare Fund, from which we spend money.
Thank you, Vipulji.
Thanks.
There are a number of very appreciative comments. I will take them on record, and in the interest of time, I'll go to the next question, which is again a question to the Consul General, Vipulji. Can you please suggest Government of India to have a comprehensive health insurance policy for every NRI? so that they can take care of each one of us as we retire and go back home?
Well, we can definitely suggest it. What happens is that for workers there is definitely an insurance, but I think because again it's inter-country, I'm not too sure as to how much it is used. And then the question of when an NRI goes back, then what kind of a health insurance you are covered in. I think currently I think it's left to an individual to buy those health insurances when you go back. I don't know if government can do it, but certainly a suggestion which is worth considering. I'm sure that that will be at the back of mind of many people who spend several years abroad and then go back home. I'll definitely.
Can I just come in here?
Yes.
Yes.
Can I just come in here, because I
Please,
was involved
please.
in one of the discussions about this. So there was one suggestion by the government of Kerala, which is very active in this area because of the large number of people here. The Norca was looking at a suggestion where there could be a contributory commitment from the worker who is here, say, from the age of 25, 30 and all, and he is going to be here up the age of 55, 60. So during this period, he contributes an amount which is being kept for him and is for his spouse, which becomes a large amount by the end of the time, by the time he goes back. And part of this is being contributed, a small part, by the government also every year. So this builds up into a very large amount, which is used as a premium, one-time premium, to cover for all serious illnesses for 15 years after he returns to the country, for him and his spouse. This is something which will really help people, because we have found, especially the people who are from the lower income category, really suffering because of the inability to access healthcare once they go back after the age of 60, 65. So this may be something the Honorable Consul General may suggest, where there can be a contributory premium which can come over a period of many years, which will be a very small sum when it is taken over a period of 25 to 30 years.
Yes, so we will definitely, I'll definitely send this recommendation to Government of India, and let's see if people back home can work on this. It's important. It's a good suggestion.
Thank you very much. That was a suggestion from Melvin Cornelio. There is another question for Dr. Azad Moopen, which relates to insurance companies. He says, in all insurance companies, James Matthew says all insurance companies should be asked to pay and settle payments to healthcare operators. I think he's looking to IBPC to take the initiative, but I know there is an insurance group and there is a healthcare group as well that is working on this. Would you like to comment on this?
Yeah, definitely. So we will make James Matthew our advocate in this. We are trying very hard, but one good thing is luckily, or taking the importance of the situation, the Dubai Health Authority has issued an executive order to the insurance companies to pay up the balances where there is no dispute. So undisputed amounts which are lying with the insurance companies, this has to be paid to the to the healthcare providers, because of the reasons which I mentioned earlier. There's a huge cash flow issue for the insurance companies. So government has taken some action. We haven't got the full amount, but at least there has been some improvement in the payment from the insurance companies. And definitely this is something which will be required for sustainability of the healthcare organizations. And I'm sure along with the business group, which is active, where the hospital companies, hospital groups have joined together, we'll be able to drive it forward. And we hope that there will be good payment coming into the healthcare providers.
Thank you. I think there are many appreciative comments and applauding the philanthropy of the panelists and the initiative taken by the consulate. I'll close with one question, which is the last one, which is really aimed at suggesting that this is both Mr. Rajesh Agarwal and Dr. KP Hussain, suggesting that IBPC, each member contributes 500,000 dirhams so that we can raise a 2 million dirham corpus which can then be used to support needy requirements and the initiatives that the Indian consulate is taking in terms of travel expenses of Indian community members returning to India. So that's really a comment more than a question. I'd like to thank you. I think
if I could say, Sureshji, if I could say one thing on this, the consulate by itself does have the Indian Community Welfare Fund, and we can do a limited number of activities, but it's limited in scope in certain sense, but still it's very, very nice. It's quite a limited but quite a wide scope at the same time as well. So for example, we will be able to take care of several hundred people when they return back home in terms of paying for their tickets. There are some things that we cannot do, the consulate cannot do with that. So if IBPC, if it can have such kind of a fund, and then you yourself can form a committee or something, and then the consulate and the IBPC can work together to see that things that we cannot do, those can be done through IBPC. So just a suggestion, but its point is very important that we can have other sources of helping people also, and those are community funds.
No, thank you. I really appreciate it. I think these are ways by which we can make this strategic, sustainable, over a period of time, rather than responding to every crisis by having to rally the community. The community can, on a sustained, ongoing basis, support such initiatives. I'd like to thank all the panel. I'd like to thank you, Vipulji, for coming us and giving us your advice, your directions to us. I really appreciate that. I'd also like to thank Dr. Azad Moopen. I know he's very busy, as indeed the Consul General right now. But the moment I mentioned philanthropy, he was forthcoming almost immediately. I really appreciate that. Paras Ji has always been a pillar of support to IBPC. I thank you for being on this panel and sharing your thoughts and views. And Surender Ji is very much part of IBPC's steering committee. So I appreciate the contributions. So thank you very much. We'll build on this. These are some excellent suggestions and directions, and we will include the leadership of the community in taking this forward. Thank you.
Thank you.
Thank you very much. Thank you.